Hey guys, Dr. Jeremy Roser here, and
Dr. Shane Parker.
woohoo! And one of us worked today, and one of us didn't. So you get Gas Monkey today. So today we're talking about lower extremity problems, basically from the hip down. So a couple things with the lower extremity hip. Typically, people say, "Oh my gosh, my hips hurt," and they point back here, right? That's actually. You want to explain that?
That's the SI joints. Our actual hip is going to be here on the side where the ball and socket come into the pelvis. So almost all day long, everyone's, "Oh, my hip, it's so bad." That's either going to be lumbar or SI. Today, we're really going to be focusing on the hips, the knees, and the ankles.
Yep. One of the most common hip injuries is a labral tear. The hip is a bony ball, bony socket, but inside the bony socket, there's labrum, which is soft tissue. With repetitive stress, with injuries, there can actually be tearing of that, typically diagnosed with an MRI, but can be really improved with stem cell injections or platelet-rich plasma injections, as well as some of the passive therapies that we do.
Correct. So, if it's pinching in there, a lot of times just some good joint mobilization followed by some soft tissue trigger point work, PNF or active release, followed by stabilization rehab exercises that we do here.
Yeah.
Most of the time that can stabilize it and allow those tears to heal on their own if they're, mild enough.
Yeah, as well as cold laser can help
Absolutely.
stimulate ATP production in the cell and help regenerate and heal tissues as well. Also, connected to the hip, you have your psoas, your hip flexors, your IT band. You hear runners say they have IT band syndrome. That's tendonitis of the iliotibial band. Again, treated with passive therapy, adjustments, massage, regenerative medication, injections, things like that. Knee, typically you have your MRI diagnosed conditions that meniscus tears, ACL, PCL, medial lateral collateral ligaments. But one of the real common ones that we treat here is called runner's knee. It's actually patellar tendonitis. It's the quad tendon becomes the patellar tendon, goes over the knee, and then attaches down in the tibia. But right in that fleshy part right there, there's actually a tendon that can get really inflamed. And what are some of the things we do for that?
Again, chiropractically we'll do some joint mobilization, a lot of work kind of releasing the quads and teaching you how to keep that relaxed and loose and what can be causing that pulling on that tendon that pulls across that bone.
Yeah. Muscle stimulation, ultrasound, cold laser.
If it starts creating, conditions that often come in that we hear of chondromalacia patella, where that patella is driven into that socket so much that it starts getting rough and grindy. Mobilization helps with that, but really regenerative medicine comes into play there as probably the most significant way that we can get in and help smooth that out and regenerate that cartilage.
Remember, when you hear tendonitis, think of platelet-rich plasma injections. PRP is your body's own stem cells. It's the plasma, the liquid gold that they take out of your blood. They centrifuge out the red blood cells in the plasma, put the plasma back in. Has amazing regenerative properties. Heals a lot of tennis elbow, golfer's elbow. But like when we're talking hips, IT band, patellar tendonitis. And as well as down in the ankle. When we get to the ankle, you have your Achilles tendonitis. Again, PRP is amazing. You guys have heard of cortisone injections. Cortisone's great for decreasing inflammation, but cortisone does have a tendency to demyelinate the sheath of the tendon. So when you get into really skinny tendons like the Achilles, a lot of times orthos don't want to do cortisone injections in there because it could potentially lead to a rupture. And I don't know if you guys have had any friends or yourselves that have ruptured an Achilles tendon. It draws up like a window shade. It's a nasty, nasty injury, and it's a nasty, nasty surgery too.
Absolutely.
Yeah.
So PRP and some of the other things that we offer are much safer in the regards of those smaller tendons for sure. Absolutely.
Foot conditions, tarsal tunnel, which is the foot version of carpal tunnel, where you have nerve impingement, as well as plantar fasciitis, which is a lot of times you get a heel spur with it. The fascia underneath the foot is really, really taut, really, really tender, as well as adjustments and joint mobilization. Again, therapy is amazing. Cold laser, taping, orthotics. We actually do foot levelers orthotics here, which actually help with the 3 different arches of the foot to increase the position of those arches, to take the pressure off or stress off the tendons, muscles, ligaments on the bottom of the foot.
We do a lot with the foot. It's the foundation. It's what we stand on, walk on. So if you don't look at the feet and adjust and move the foot around, we can't expect everything else to work with it too. So orthotics play a huge part in really stabilizing that foundation for us, so that everything else can follow suit and just overall function better.
Good deal. Thank you, Dr. Shane. So we have, shake your hand, brother. We have, short of under anesthesia injections and surgery that we don't do here, we pretty much do the whole gamut of regenerative medicine, nurse practitioner, medical doc, chiropractic, medical massage, you name it, rehab, physical therapy. We're your clinic. So again, 972-317-3146. Village Chiropractic, open Monday through Saturday. Dr. Shane, Monday, Wednesday, Friday, right here in person. So thanks a lot, Dr. Shane.
You bet.
We will talk to you later. Have a great weekend.
Bye, guys.